All right, well, let's talk about Alzheimer's disease, which is the leading cause of dementia, which, of course, people fear as much as dying. They don't want to sit in a wheelchair and drool and not be able to carry on conversations or know what time or place you're at. That's what we're facing. It's becoming demented as life goes on. And of people who suffer from dementia, which is all too common, somewhere between 60 and 80% of this dementia is due to Alzheimer's, which is what we're going to talk about. There's other causes of dementia, such as alcohol and small strokes and some other toxicities that people can run into. But 60 to 80% is due to what I'm going to talk to you about now. So how do you diagnose Alzheimer's disease? You do it based primarily on history. You can get some added information by doing sophisticated testing, such as CAT scans and MRIs and PET scans and perfusion scans of all kinds. But really, to diagnose it in the live state, in the dead state, you can make the definitive diagnosis. We'll talk about that in a minute. But when you're alive and walking around, to make the diagnosis, the doctor has to kind of listen to you, give you a few tests, realize that you're becoming demented quite quickly, and put together a little bit of your family history, et cetera, and then come to a conclusion this is probably Alzheimer's disease. But how do you really diagnose it? You can't diagnose it until you have brain tissue. So you're going to do a brain biopsy, which is not something routinely done, or on autopsy, somebody's going to take a sliver of your brain tissue and put it under a microscope, and you're going to be able to make the diagnosis that way, because Alzheimer's has some very characteristic lesions seen under the microscope. They're called pathognomonic lesions. And there are certain things I'm going to ask you to pay particular attention to as I go through this presentation. So that's the way you make the diagnosis, is definitively you have to look at a piece of brain tissue. But you get a pretty good idea just by your clinical examination, history, et cetera. What I want to talk to you about is the new, highly profitable treatment of Alzheimer's disease using amyloid-clearing monoclonal antibodies. So in the laboratory, the scientists are able to create antibodies that attack certain proteins. In this case, they would be proteins of the monoclonal antibodies that are attacking amyloid proteins, beta amyloid. And so they make these antibodies against this particular protein that's present in the brain. And as a result, the antibodies are supposed to clear the brain of these proteins, the amyloid. All right, well, that's well and good, except, these kinds of things that they're trying to clear, proteins that they're trying to clear, are the result of inflammation and damage. They're not the cause. These drugs are never sold as the cause or the cure. They're never sold as the cure. It's never claimed that the beta amyloid, the protein that we're going to talk about, the neurofibril tangles, and they never talk about that being the cause. But the idea is that they go in and clean up the debris from the damage, that somehow they're going to improve the clinical outcome for the patients. And so they've invented these medications. And as mentioned, the antibodies are to mop up a protein called beta amyloid. Now, I'll show you beta amyloid in a minute, so it won't be confusing. But let's talk about the onset of these medications over the last couple of months. In fact, last month, most of this occurred, at least as far as the public's attention. July 6, 2023, the FDA approved Leqembi. Leqembi is the first of the monoclonal antibodies that came to market for the treatment of Alzheimer's disease. And what they showed, and I want you to keep these figures in mind, they showed over a period of 12 to 18 months, in this case, it was 18 months, what they showed was a 27% reduction in progression of the disease based upon clinical outcomes. So they took a bunch of people who had Alzheimer's disease, a certain degree of Alzheimer's disease that was similar. And they divided them into two groups. One group did not get the monoclonal antibodies. The other group did. And then they followed the course, like in this particular study, they followed the course over 18 months. And they tried to see, based upon people's ability to function, take care of themselves. As much dementia as they developed was assessed and compared to those who didn't get the treatment. 27% reduction. 7% reduction. Keep that in mind. 27% reduction, 18 months it took. You had to get an injection once or twice a week. In some of the therapies now, it's one injection every 4 weeks. The cost annually is about $25,000. But the real hooker is here. In addition to only having a 27% reduction in progression of disease based upon looking at the patients, that's how they tell. Not by doing any biopsies or any blood tests. You look at the patient and see what happens to those who are given the therapy, the intervention group. And what they found is, like I say, a minimal benefit. Never claiming that this treatment was to deal with the problem as if they were going to get a cure. And then what we find is that this is a dangerous therapy. They give these intravenous check-ins, like I say, up to twice a week or every 4 weeks, and they have to do MRIs on the patients, and they do it for they do 3 MRIs over the first 6 months of therapy. And what they find is that in Leqembi, for example, 20% of the people show brain swelling and or bleeding, and some people die as a consequence of this particular infusion and the inflammation that takes place. 20%. And the newer drug that was just the study was published on it. It's Donanemab. I probably have that pronunciation wrong. MAB stands for monoclonal antibody. That's what the end of each of these particular names refers to, is MAB is a monoclonal antibody. So in the study that was just published July of 2023, they used another more powerful, more directed antibody, the Donanemab. Again, you can criticize me on the publication or the pronunciation. So they saw at best a 4-month delay in progression. And over 18 months, there was a 36% decline in progression. All right, 27, 36%. Keep those numbers in mind. Cost, similar, $28,000 a year. But in this case, 37% of the people treated had problems that they refer to as amyloid-related imaging abnormalities. In other words, brain damage, swelling, bleeding of the brain from the drug. The criticism is, and it should be from a scientific point of view, is that the amyloid, which we're going to talk about, you're going to know what the amyloid is, the fibrous tissue, is really a minor issue when it comes to the cause and progression of this disease. So let's just summarize here. Current therapies, very popular, very controversial among scientists and doctors, extremely expensive, extremely toxic, with extremely little benefit. And that's what you're being sold. But you're desperate. You're with a loved one who's deteriorating right in front of your eyes. You want to do something. And besides that, with the FDA approval, the drug companies and Medicare, et cetera, are likely to pay for this treatment. All right, you're going to keep that in mind as we talk about the cause of Alzheimer's disease and what I would like to have if I had this problem, how I'd like to be treated, and how I've treated my patients for the last 40 years who have Alzheimer's disease. Louis Alzheimer discovered this disease in 1901. And of course, that's where the name comes from, is Louis Alzheimer. What he did is he noticed a patient who had rapid progression of dementia, more rapid than you would expect to see. It was in 1901, and he looked at the brain of this patient, after the patient died, of course, looked at the brain under the microscopes they had in those days. And what they found is a particularly severe kind of lesion. They're called plaques and neural fibrotangles. And the amyloid is part of the neurofibril tangles. It's also referred as tau protein. So anyway, the first case was described in 1901 in a woman who had rapidly progressive dementia. By 1926, there were only 36 cases reported in the world literature. They started using aluminum during World War II. Prior to that, aluminum was not something that was available in pots and pans or pretty much any place. It was too expensive to make, and they didn't find any really good utilities for it. But with World War II, airplanes and war machines and so on, aluminum became of age. And so it was distributed throughout populations primarily in the Western world. And after World War II, the incidence of Alzheimer's disease increased to 26 million people. Today, these days, what it's estimated is 5.7 million Americans of all ages have Alzheimer's disease. So what are there, 330 million Americans, and we're talking about 5.7% of them having a pretty serious disease, 5.7 million. All right, by 2025, which is right around the corner, the number of people with Alzheimer's disease over the age of 65 is going to be 7.1 million. So it's a very common, it's an everyday problem, something you'll notice in your family. And the progression of the disease correlates specifically with the utilization of a non-nutrient, a heavy metal called aluminum. And in parts of the world where aluminum was used extensively, like the Western societies, Europe, the United States, the incidence of Alzheimer's disease has been up until recently more common in Western countries. Again, I think it's most related to the aluminum, but it's part related to the diet. In Western countries, as opposed to, for example, in Asia, it's only become a real problem in China, Thailand, Vietnam, et cetera, over the last couple of decades. This is the pathognomonic lesion that Louis Alzheimer saw under his microscope, and what all scientists would see to make the diagnosis. Pathognomonic means that if you see this lesion, these senile plaques, you see the amyloid, it's called the amyloid plaque there. You see the neurofibril tangles. If you see this under a microscope, you go, that's Alzheimer's. And if the brain tissue doesn't have these lesions, it's not Alzheimer's, okay? So that's how you make the diagnosis. And you see that the neurofibril tangles, which are also called tau protein, which is the amyloid material, which is what these drugs are trying to attack. They're trying to remove the garbage, the products of the byproducts of inflammation and injury is what they take away from, thinking somehow that they're going to correct the underlying disease and the progression. All right, let me take you back to the microscope. Here you are. You got your microscope out on your laboratory table. You're looking at the slices of brains of your favorite relative, and you see the neurofibril tangles, the beta amyloid, which is what the drugs are attacking. You see them and you say, aha, my relatives has Alzheimer's disease. And then you go back to the research to try and get an idea of how they got these pathognomonic lesions. All right. There are microtubules that are forming the inside structure of a neuron. And these microtubules, they get attacked and damaged, and they result in what we call tau proteins. Anyway, so you say, well, maybe I could get a clue as to what caused these lesions, these pathognomonic lesions. So you bring out some more technology. And in this case, you bring out nuclear magnetic resonance techniques, big, sophisticated, sexy term, right? And you start peering into the amyloid plaques and into the neurofibril tangles. And what you find, lo and behold, is the central core of the amyloid plaque is made up of aluminum silicate. Okay. So let's follow this backwards. So you find that these plaques contain aluminum silicate, and you wouldn't have a plaque without the aluminum silicate. And if you don't have a plaque, you don't have the disease. I mean, how much stronger correlation could you get with aluminum than finding this culprit right there under your microscope. You got it right there. Aluminum silicate. All right, we're going to be talking about aluminum. By the way, you can look up all the research on this, or some of the more important research that I thought was important for you to understand and examine further, and to, as I told you many times, to find out whether Dr. McDougall is exaggerating or maybe has the information incorrect. Check me on it. Here's the research on the bottom right-hand corner. Okay, so you're with me so far. You've got to have aluminum silicate to have a plaque. You got to have these pathognomonic lesions, the senile plaques, the neurofibril tangles, the beta amyloid, tau proteins. So you call them what you want, it doesn't make any difference. The antibodies are made to trying to clean up the garbage left after the inflammation. You're with me. And the benefit of the present approach is that you have approximately a 30% reduction in progression of disease compared to controls, at a cost of $25,000 a year, and at the risk of having brain damage 20 to 40% of the time, and having to go get an MRI 3 times during the first 6 months of therapy, having to go to the doctor to get an infusion. They put this through your vein, twice a week or once every 4 weeks. That's what you have to do. You'd expect a big bang for the buck, wouldn't you? Well, what you end up with a tremendous amount of controversy. And you can read about this. Doctors, scientists who were interested in the patients and their families said, this is ridiculous. This is dangerous. This shouldn't be put on to the public. But hey, they got the money. So they're going to hire the spin doctors. They're going to hire the lobbyists. They're going to get it passed through the FDA, for example, and make this available to the public. And the public's going to say, well, at least there's something to help. All right, Alzheimer's disease. Let's take a look at some of the evidence that I've told you a bit about this, but let's review it a little bit. As far as the connection to the Western diet, what we find is Asians have many fewer cases of Alzheimer's disease compared to Europeans. As far as comparing Japanese Americans to native Japanese, the incidence of Alzheimer's disease is much higher in American Japanese people as opposed to people who were raised in Japan. The same thing with Africa. You find that in the United States, Black people have 2 to 3 times the risk of having Alzheimer's disease compared to, say, Black people who are from Africa, say live in rural or even modern Africa. People with high cholesterol levels, people with atherosclerosis, in other words, have history of heart attacks and strokes, they have a higher incidence of Alzheimer's disease. And there are animal experiments that confirm the relationship between Alzheimer's and the Western diet. In fact, there's even research that says if you would put people on statins, they would benefit as far as their Alzheimer's disease is concerned. Let me summarize what I think is going on. First of all, you're talking about societies where alumina is more prevalent. Europe, United States, as compared to Asian countries. That's probably most of it. But there's also the fact that, people in the United States and in Europe, they eat a horrible diet. So, they have problems with their bowel integrity, problems with their immune system, etc. So if you're going to eat the Western diet based on meat and dairy products, you're going to be more susceptible to any toxin in the environment. So does Alzheimer's have a connection with the Western diet? Yeah, it does. Yeah, it does. Maybe a direct connection, maybe an indirect connection. Direct being that you're weakened people when you eat the Western diet. More direct being the fact that there's more aluminum in the environment of people who live in Western societies. Okay, you're up with me on that discussion so far. In other words, it fits the epidemiologic evidence worldwide. All right, so let's talk about the aluminum, which you have to have. Okay, come on now, you have to have it to have the senile plaque. You have to have the senile plaque to diagnose Alzheimer's. So let's talk about the aluminum. Aluminum is not a nutrient. In other words, you have no requirement for it, like you do for copper or iron. There's no requirement for aluminum. It's a known toxin. We particularly saw this when we were using aluminum hydroxide in the treatment of kidney patients. It's part of the therapy when somebody gets on dialysis. You put them on these aluminum compounds to reduce I believe it's the phosphorus in the patient's system. And what we found is a dementia that looked just like Alzheimer's disease in these people on dialysis that were getting as part of their treatment these aluminum compounds. 1973, brains of Alzheimer's disease, they did, well, let me show you, let me explain how they did the experiment. They took brains of people who say died of stroke. And they took another bunch of brains of people who died of Alzheimer's, and they ground them up, and they analyzed the aluminum content in the different brains. And they found that those who had Alzheimer's had a much higher aluminum content in the ground up brains. 1937. They've exposed animals. I know you don't like to see animal experimentation. I can sympathize with your cause, but it's valuable information to see what happens in animal studies, and I don't discount it. I have some feelings about it one way or the other. So you expose animals to aluminum, and they develop pathognomonic lesions. They develop senile plaques, amyloid plaques, neurofibril tangles, tau proteins, all the terminology that you hear that you see in the human. And we also have many experiments that are done that look at the aluminum content of drinking water in various communities. And those who have a high aluminum content have a higher rate of Alzheimer's disease, as much as 3 times the risk. So as you get older, your gut is more permeable to aluminum. And that may be one of the reasons that it becomes more common as people get older. It's a disease of older people, even though it does occur in younger people. And then we're going to have a more definitive way of looking at this, which is in terms of a cure. Remember, your monoclonal antibodies are never being sold as a cure. But what I'm going to tell you about, I interpret as a cure of Alzheimer's disease. Not a reversal. The damage that's been done is done. It's not reversed. But what you can do is you can dramatically slow the progression of the disease, which at best, these monoclonal antibody treatments, they cost you $25,000 a year, give you brain damage 20 to 40% of the time. That's not a cure. So let's go on to more definitive evidence as to the involvement of aluminum. Where does aluminum come from? Well, it's prevalent in our society, and where we eat aluminum most commonly is in our processed food products. For example, sour cream preparations have high aluminum content, processed cheeses, pancake mixes, baking powders. There are some baking powders that have aluminum. There are other kinds of baking powders that don't. And you compare the aluminum content, which is in the box on the upper left-hand side of these prepared and packaged foods, to the amount of aluminum that would be in natural whole foods. You can see the dramatic difference. Okay, the next source that comes from your food has to do with how you prepare your meals. Here on the bottom left-hand corner, you look at the box there, and you see that the aluminum content of applesauce, uncooked, not much. But if you cook the applesauce in an aluminum pot, guess what? You increase the aluminum by like 21 times. You cook it in a stainless steel pot, you don't increase the aluminum content. So cooking and the kind of cookware you choose can make a huge difference. Look at tomato sauce. 570 times increase in aluminum content in the resulting tomato sauce if you cook it in an aluminum pot. Yeah. There are certain medications like Citracal contains aluminum. I'm sorry, Citracal will increase aluminum absorption. Okay, Citracal does not contain aluminum. But if you take antacids that have citrate in them, you increase the absorption of aluminum from other sources by 8 to 11 times. All right, there's also aluminum in teas. And those who are a little bit sophisticated and will try and defend their own particular habits and talk against what I was trying to tell you will point out that tea also has a lot of aluminum in it, but it doesn't cause Alzheimer's disease. It's because the aluminum is complex in the plant substances, so it's not absorbed. It's not absorbed. Yeah, right. So that's where you get the aluminum from. But it's not the more serious source of aluminum. What we discovered back in the 1940s, when we started doing autopsies on people who had Alzheimer's disease, is that when you looked at the brains, you found those with the most serious dementia had these pathognomonic lesions. Remember, neurofibril tangles, senile plaques, amyloid, tau proteins. Come on now, we've talked about all that. It's right there in the center. What they found is you found more of these senile plaques with the most severe disease. The senile plaques are present in the greatest density in the olfactory lobe of the brain. Okay, you see the brain down here in the center bottom. The brain has an extension. It's not a nerve. It's part of the brain. It has a stalk called the olfactory lobe. And the olfactory lobe goes from the center of the brain to the nose. And nerves poke through the top of the nose into the nasal cavity. And it's through this portal that you get the most aluminum and the most disease. It's through the nose, not through the gastrointestinal tract. You get, you're able to absorb it through the GI tract, but it's through the nose. And where they discovered this first was industrial workers. Like, for example, those people who worked at making brake linings, they had to work with aluminum compounds. And they're the ones that had the lesions in the nose, in the olfactory lobe, that also had the most severe dementia. All right. Well, that probably wasn't very important until about 20 years ago. It became popular to recommend to people that they stop perspiring. And so antiperspirants came on the market. These are different than deodorants. Deodorants just cover up odor. Antiperspirants make you stop sweating. All antiperspirants are made of aluminum compounds, aluminum chloride. All of them. So what happens, and what the most common portal of entry is now, is every morning, a good share of our population takes and sprays aluminum into their nose as they douse their armpits to stop themselves from sweating. Now, as a consequence of this becoming a popular notion that these antiperspirants are a likely serious problem when it comes to the development of Alzheimer's disease, they basically went off the market. They sold antiperspirants as roll-ons and lotions and so on, but no more aerosols. And that stopped for quite a while until now. If you look at Amazon, you look at wherever you buy your antiperspirants and your deodorants, what you'll find is they're back on the market. So every day you spray this huge dose of aluminum into your nose, which is the most serious portal of entry, which results in the most serious dementia. All right, now let's talk about the causal relationship. I think I've established for you pretty well. And if I haven't, you can just do the reading. It's overwhelming. But of course, we're dealing with the aluminum industry. The aluminum industry, which of course you're dealing with the fluoride industry, because aluminum comes out of the ground as aluminum fluoride. So you're dealing with two big industries here, and there's a great amount of money at risk. And so they have their spin doctors who go out and try and convince you that aluminum is totally incidental. It has no big role to play, and certainly not causative. And that's why you have monoclonal antibody treatments are popular these days, is because the aluminum industry is very happy about this because it's taken the guilty light off of the aluminum. All right, so studies done. And I want you to remember the monoclonal antibodies, they gave a decrease in progression of disease between 27 and 36%. All right, a 2-year trial of 63 patients. This is a randomized control trial. Okay, the ultimate in science. Those who got this treatment is an aluminum chelator, which removes aluminum from the body. They were in twice as good a shape as those who were in the control group. All right, so what is that? That's 100% reduction. I don't know, how do you do these percentages? 27%, you don't call it 50%. Anyway, they did twice as well. much better than you ever did with the monoclonal antibodies. And this kind of therapy is pretty much non-toxic. It's been proven to remove aluminum from the brain and the body. Cheap, that's the problem. It's not a brand name drug. It's generic. It costs pennies. The excuse doctors give for why they haven't used this chelating agent called deferoxamine is they say, well, it's just too painful. Excuse me, it's just too painful? Yeah, to get a shot in your muscles once or twice a day. That's just too much to ask for a patient to do. Whereas we can have them go for 3 MRIs during the first 6 months of therapy. We can have them to suffer brain swelling, brain bleeding, and possibly die at a rate of 20 to 30% of the people treated. We can ask them to do that, but it's too much to ask them to have a shot. We can ask them to go into the doctor's office and have an infusion, twice a week, once every 4 weeks. We can do that, but we can't give them a shot. Deferoxamine. This has been extensively studied. Safe, inexpensive, available, and what it does is it works. I just wrote a letter to the editor, and hopefully it's going to appear within the next 2 or 3 weeks in the Journal of the American Medical Association. They just published a big study on one of the MAB drugs, monoclonal antibody drugs. I showed you the results. You can go look back in the slides. I'll look at them with you again. And I wrote him a letter to the editor, and I'm just going to tell you the summary of it. It explains the drawbacks of these MAB, the monoclonal antibody drugs. Same data that I just gave you in the first slide. And then I explained to them about deferoxamine. And then what I ask is, why haven't we done studies? Rightly, there's only 63 patients here, but it was a randomized controlled trial, which is the highest in science. Why haven't we invested the money to use this therapy to prove it works or doesn't work? This is a cure. This is a cure. This doesn't mean you're going to reverse the damage. You're going to be just as demented, but the progression of the disease will stop or slow at a far greater rate than the monoclonal antibodies can cause. There are a couple other derivatives of this deferoxamine that you'll also find there. My one hope is that they'll develop a chelating agent similar to deferoxamine that will be patentable, so that they can put out the message, they can educate the population that aluminum poisoning is the cause of Alzheimer's. It's due to aluminum poisoning. Did I say that clear enough? Did I hesitate at all? All right. So what can you do right now if you believe what I say? You're not going to go down and get deferoxamine shots. Unless you have the disease, you might go looking for it. You might talk to some of your healthcare providers and ask them to take the trouble to get deferoxamine for you. Then you can take it home and inject it in your muscles yourself. But you can also do this. You can also take in silica. Now, silica is an organic compound, okay? It's not silicon. If you see down in the bottom left-hand corner, silicon is an element. Silica is a compound. It's made of silica, but it's a compound. It's found in the earth, and it's found in plants. And you can buy silica in various kinds of silica-laced waters. Living silica is one of them. Fiji water is another one. There are dozens of them out there. And the amount of silica provided is 86 milligrams per liter. All right, this is, I don't know how many my bottle is, what is 500 milliliters. So you can drink one of these bottles and you take in 43 milligrams of silica. 10 milligrams a day of silica is associated with a reduced risk of Alzheimer's. So in other words, what you'd have to consume is a quarter bottle of water a day to remove enough aluminum from your body using silica to make a difference as far as your risk of developing Alzheimer's. Pretty cheap, pretty non-toxic, pretty profitable for Fiji waters and similar ones. But there are also teas. The teas that contain silica, they're sold as tinctures and capsules. A couple of the teas that I noticed that were high in silica, you'll find others, are horsetail and bamboo tea. So you can get started right away. You get started right away by not consuming aluminum, either through your nose or through your gut. Easy to avoid. I'll see if I can get Mary to come out here in a few minutes and tell you what we do in our home in terms of avoiding aluminum toxicity. So you want to do that. And if you have any concern, I've been aware of this for 40 years. We have not had aluminum in our home for 40 years. Just add a side note here. I can remember when I was a little boy, I must have been 8 years old, a pots and pans salesman came to our door and tried to sell another set of cookware to my parents, who were pretty broke at that time in their life. And what he did is he put something in the aluminum pot and pan and showed that cooking aluminum pots and pans resulted in all these deposits of aluminum. And, they asked my parents, do you want you and your children to be eating this? So that was that was like 70 years ago. They knew about this. All right. The research is in the bottom left-hand corner or bottom right-hand corner. You can read it. And the nice thing about what I tell you, for those of you who have any doubts of the sincerity of the amount of information that backs up what I say, is just look up the research. What you'll find quickly is this research is forgotten and buried. Why? Because there's no money. All right. So this is it. This is what you're being offered, you and your family. You're being offered these monoclonal antibody drugs. There are new ones coming out all the time, but they all do the same thing. They induce antibodies that attack the garbage left over from the inflammation due to aluminum. So the aluminum goes into the body, deposited in the brain tissue. It's not supposed to be there. The body reacts to this aluminum as if it was a invading substance, as if it was a foreign body. Okay, so you got globs of molecules and globs and slivers of aluminum in your brain, and you can actually see these in electron microscopes. If you want to take and pursue the research, you'll see slices of the brain tissue that show aluminum associated with these neurofibril tangles and senile plaques. It's right before your eyes. If you remove the aluminum from the body, then you stopped or slowed the progression of the disease, which is what the research showed in 1980, but it's been totally ignored. And the price paid is the patient. The profits made are the drug companies. Get real.